A lot of my patients enjoy swimming or doing aqua aerobics. It's a good way of keeping fit and strong. If you've got stiff, painful joints though, the water is quite soothing and the buoyancy helps to offload some of the stresses on your hips and knees. But what about swimming after surgery? Keep watching and I'll tell you why it's such a good thing to do. Even if you aren't a strong swimmer, just doing exercises in a pool is helpful because you have to work against the drag or the resistance of the water. When's the best time to start? Well, if you're able to do it before surgery, you'll reap the benefits of being a bit fitter and stronger, and this will certainly help you to recover more quickly. After your operation, it's probably best to wait until you aren't really thinking about your hip anymore before you jump in. For most people, this is about 3 months after surgery. The wound needs to be clean and dry, and you shouldn't be taking strong painkillers because, of course, these can make you feel drowsy. It's important to be careful in the pool and around it because of the risk of slipping and falling. Using a ladder to get in and out of the pool can be quite challenging, but most public pools have steps that make it much easier and safer for you. Some hospitals have hydrotherapy pools. These are excellent because you'll be in a safe environment under the supervision of a physiotherapist. If you're using a public pool, just choose a quiet time and don't be too ambitious at first. Walk a few widths and then see how you feel about doing some gentle strokes. Is it safe to do breaststroke after a hip replacement? Well, there's lots of conflicting advice about this, none of which seems to be based on any hard evidence at all. The concern that some people have is that breaststroke might increase the risk of a dislocation of the hip. This is when it comes out of joint. It's pretty unusual, and I've never known anyone have a dislocation when they've done breaststroke after a hip replacement. You should check with your surgeon though to see if they have any concerns about your hip that might increase the risk of a problem. Some people enjoy so-called wild swimming in lakes and rivers. They're usually confident, strong swimmers to start with, and I wouldn't have any concerns about them returning to this. However, these are high-risk environments because of slippery rocks, underwater hazards, and of course strong currents. You need to be very careful and be familiar with the place where you choose to swim. The water isn't always particularly clean, so there's always a risk of picking up an infection, particularly in the first 6 months of surgery, so it's best avoided until after that. Swimming in the sea is fine as long as you're aware of the usual hazards like strong currents and tides. Like any activity after surgery, just take your time. Don't be too ambitious at first. Plan ahead and feel your way. After a short time, you'll quickly regain your confidence and start to forget you had a hip replacement at all. If you'd like to know more about this, then please get in touch. The details are below. Thanks for watching.